We're going to have loads of talks today, loads of talk on this stage. We will also have master classes on the top floor, so it's just 2 floors up. You gotta go up the stairs, or you can take the elevator if you don't want to walk up there. It's not a problem. Eva will be there with you. She will welcome you, and you can have some master classes with special, great people. All right, you good to go? You good to go? Ready? Yeah, that's really cool. Our first talk will be about tobacco harm reduction. And first question, who is confident in explaining tobacco harm reduction to regulators or customers? Like
Sairah.
Low confidence level, maybe a little bit. So who's mid-level confidence? High-level confidence? You high-level confidence? That's pretty cool. Well, I would have questions if you wouldn't have been like as confident, but that's really good to know. First of all, we want to give you some presentations, some insights on psychological traits of tobacco harm reduction, and also on the regulatory side. And then afterwards, we will have a special guest with us also, and the 2 panelists, and we will have a little discussion, and you can ask some questions too. First of all, let me introduce you to Dr. Sidney Hiller.
Yay.
There are some slides coming.
You gotta dance.
I don't think anyone wants to see that.
Get my popcorn.
But thank you all for being here, bright and early, after what is probably a late night for everyone. So today we're going to go into tobacco harm reduction, the latest science in the public health. We're going to kick it off with some of the science. All right, so we'll start with the diagram that most of us are probably familiar with, the risk continuum. So over on the right-hand side over here is the highest toxicity. We start with cigarettes, combusted cigarettes, which are, of course, the most toxic. And the whole idea is moving people down the risk continuum. So whether that's going from cigarettes down to vapes and e-cigarettes, or whether it's going to modern oral products, which you'll see are all the way at the far end next to NRTs. This is the idea of harm reduction when it comes to the science, and really transitioning folks down that continuum of risk. So we're going to start with a really quick high-level overview of some of the regulatory bodies and pathways that are there. In the US, you can either market your product as a medicinal product, an NRT, that is of course going through CEDAR, or you can go through the PMTA process and the Center of Tobacco Products if you want it to be a consumer product. Similarly, in the UK and the EU, you have medicinal pathways, whether that's through the EMA or the MHRA, and consumer pathways, whether it's through TRPR or TPD. But today we're going to focus on the consumer pathway as a PMTA through the Center of Tobacco Products, and a consumer product in the EU, which is governed by TPD. So again, just a really quick high-level overview of currently TPD process is a notification process. You're going to complete your non-clinical testing, form a dossier with everything that all the data that you've compiled, and submit that 6 months prior to when you want to launch your product on the market. The PMTA process is a bit more lengthy, let's say. So you start off with the submission, then you have an acceptance review. At that point, will either be accepted or you'll receive a refuse to accept, an RTA, followed by a filing review, where you'll receive an RTF or be filed. Then there's substantive scientific review, if you are filed. And you'll note that there is a 180 days there, with a couple of asterisks, because in Section 910 of the Tobacco Control Act, the legislation says that this process should take 180 days, but as I'm sure you're quite aware of, that has not been the case. So, a little bit about what goes into these TPD notifications. You have the non-clinical testing portion, which is nicotine quantification, ingredient purity, emissions depending on the product, if it's applicable, some other just testing, stability, and also a toxicological dossier for each ingredient. You then take all of this data, compile it into the dossier, and submit that. A note with TPD, under TPD 2, nicotine pouches are not currently covered. They're in somewhat of a gray area, but this is expected to change with the implementation of TPD 3 coming soon. So a diagram most people are familiar with, the evidence that's required for a PMTA. We like to think of it in 7 different modules. I've left off the bottom 2, which are administrative and just summaries. And so focusing on the bottom here, which is going to be your CMC, your design, controls, manufacturing, followed by your non-clinical testing, which is really at the core of the application. And everything from there will build on this foundational testing. So, some of the evidence that's required for this. You have to demonstrate that you have consistent and reproducible manufacturing. You again have to do HPHC, or harmful and potentially harmful constituent testing, product stability, extractables and leachables, and toxicology. So what we do is a lot of the analytical testing, and by design try and find ways where there can be some overlap with these testing, and that way you can utilize the testing whether it's for TPD or for your PMTA. And the goal of that is to design these studies smartly so that you can end up saving money in the end. All right, and just a little quick bit if you want to connect with us.
Thank you very much. We will see her again in a couple of minutes, but so this has been more of the science side of you, right? Let's switch to the consumer. So what actually brings people to switch from smoking to vaping or other alternative products? And we will have some insights from Sairah. Are you with us? You're with us. Please applause for Sairah. She will give us psychology insights.
Morning, everybody. Lovely to see you here today. My name is Sairah Salim-Sartoni. I'm a health psychologist and the managing director of Salim-Sartoni Associates, which is a company that supports the industry within matters of public health, consumer research, and engagement. So today we're going to be looking at a little bit of the public health science angle, but mainly from the consumer's point of view. And I suppose because I trained in public health and I was a public health specialist for 18 years, my way of doing things is always to speak from that, gaining that public health that prize. So if we can have the next slide, please. So the public health prize is usually summarized as achieving that reduction in smoking prevalence and a reduction in smoking-related disease and death. We're going to look at who wants it, who needs it, how we can achieve it, and if we don't achieve it, what is the alternative for our consumers? So before we do that, I just want to remind everybody about the relative risk of the products that we're talking about, and a little bit about the evidence and the science. Next slide, please. So the wonderful thing about this illustration here, and I'm sure you guys have seen something like this before, is that this is not from industry. Okay? No one from industry produced this. This has been produced by the Royal College of Physicians in the UK, and it has been taken and adapted from the American College of Cardiology Foundation. So this is what I like about this. This is not the industry going, look, this is how safe these products are. No, these are medical institutions in the UK and the United States that have deemed these products and looked at them in the risk continuum. So obviously, as Sydney was saying, you've got combustible tobacco, then heated, smokeless, e-cigarettes, pouches, and medicinal nicotine. But you can see that the pouches are very much near the medicinal nicotine. So every time innovation, it's getting better and better and better. So let's look at the latest data. So the latest data looking at, next slide please, sorry. The latest data looking at the evidence for e-cigarettes is basically focusing on the latest systematic review, which is a gold standard review, and that took in, oh thank you. Oh yeah, I was wondering, how am I going to do that? looking at 104 studies and looking at effectiveness as a smoking cessation tool and safety. So they did found that nicotine-containing e-cigarettes are more effective than NRT, they're more effective than non-nicotine e-cigarettes, and they're more effective than behavioural support alone. Evidence on serious adverse events remains inconclusive, but the evidence for other adverse events suggests there's no difference between nicotine e-cigarettes and comparison treatments. So that's really, really big. If you're looking at these kinds of events, if I look back at my clinical background and I think about some of the medications that we're giving to people to stop smoking, you would get nausea, you would get dizziness, you would get, so adverse effects are there everywhere, but it's good to see that for e-cigarettes, there wasn't much difference between nicotine e-cigarettes and comparison treatments. The last bit of evidence I wanted to look at was basically taken from the smoking toolkit study that the University College London produced, and they did a paper with King's College London, basically saying that in England, I don't know if you are aware, but we do have a program called Swap to Stop. Can I have a show of hands of people who've heard about what Swap to Stop is? Okay, some, not all, so I will explain it to everybody. So because e-cigarettes in the UK are actually part of clinical guidelines for smoking cessation, so the NHS agrees that smoking cessation is, e-cigarettes are good for smoking cessation. What they did was they integrated e-cigarettes. The government funded 1 million vaping starter kits to stop smoking services for them to give out to their patients to make a quick attempt with. So this is part of a health, it is basically a health treatment, let's say. So it's used just like patches are, just like Zyban is, but it's used for smokers to help them stop smoking. Basically what the data found was because of this Swap to Stop program, an additional 125,000 quit attempts using vapes were attributable to this program. So not just the people who were coming in and receiving those vape kits, but because trust is increasing within the health services, people are feeling that it's actually, if my friend is going along to the stop smoking service and they're getting a vape kit, oh, well, I don't have to go to the stop smoking service, but I can, if they're getting a vape kit, then it must be okay to get a vape kit and stop smoking with something like that. So the evidence is there. So now we've dealt with that, let's have a look at the impact of smoking on the EU at the moment. So when we think about whether we need this or we want this, smoking is killing 650,000 to 700,000 people annually in the EU, which is a massive figure. It's costing now around about 98 billion annually in terms of direct healthcare or indirect costs. And as we know, the EU want to be smoke-free by 2040. So that's less than 5%, and that's part of the Beating Cancer Plan. So the whole tobacco-free generation is part of the whole strategy of the Beating Cancer Plan program in Europe. Unfortunately, the adult smoking prevalence in Europe is 24%. In England, it's 10.6. There's a bit of a difference there. Within the 15 to 24-year-old smoking prevalence, it's actually higher, it's 29% in the EU. Can anyone hazard a guess as to the prevalence for 16 to 24-year-olds in the UK?
5%.
It's 8%. So, and tobacco harm reduction has very much been implemented in the UK. So it just goes to show what can be achieved if policies can support harm reduction strategies. So obviously you can see from those figures that the current strategy has failed in the EU, and I think from my point of view, and I'm seeing this as a clinician, from my point of view, it's mainly because they're not understanding that smoking is a chronically relapsing condition. It's extremely difficult to get out of. It's not just whack on a patch and you're done. It really isn't. It's very, very difficult to do this. So unless you understand that it's a chronically relapsing condition, you won't understand that, you need to throw everything and the kitchen sink at this. And at the moment, the EU Health Commissioner deems reduced risk products to be as harmful or more harmful than smoking. So there's no willingness there to be open to the independent science or the potential of reduced risk products. So that's EU. They want it, they need it, Whether they're wanting to throw everything but the kitchen sink at it, I don't know. But you can see that they actually need it and want it, and so they really need to find a way to achieve it. This gentleman here represents people who smoke. I don't like saying smokers, so I usually call this smokers Johnny. Johnny is my uncle who smoked 40 a day for many years and gave up with an e-cigarette. But 60% of people like Johnny want to stop smoking. And that's a very high number, and that's regardless of whether they come from a vulnerable background or not. So 60% want to stop smoking, and so they want it. Do they need it? Well, 2 out of 3 will die prematurely if they don't stop. So again, because it's a chronically relapsing condition, and you'll hear me say this again and again. So I'm just going to read you a quote of how difficult it is, and I'm just going to break it down, and I won't spend more than a few minutes doing this. So this is a quote that comes from Facebook. It's one of the the support groups out there. And so it's an anonymous quote, and it reads, "I'm currently smoking my last cigarette, and this is about my 40th attempt at quitting that usually just lasts until the next morning." So you can tell from there how hard this is. I'm doing it again and again and again and again, and it usually only lasts until the next morning. "I have a young child, and I just want to be better. Save the wasted dollars, be around for my family, and not feel guilty and disgusting every single time." And there you can see from that quote there, the need and the want to do it for the family, for the economic benefit for the family, and the shame, the disgust, feeling guilty. This is a horrible thing to have to go through and to live with, and that's how it makes people feel. "I'm nervous for the days to come, but I feel this time I can do it." So that kind of gives you that there is hope at some point. And I think what we're needing to do is we're needing to try, as an industry, to try and produce products that kind of give people hope. So the need and the want and the right to tobacco harm reduction is there. I won't spend too much on this slide because I can see Philipp walking towards me. But the point I'm trying to make here is that the people who need it the most, the people who are left smoking in the populations right now, they are the ones that are needing it the most. They are the ones that have the high nicotine dependence, the low income, the mental health conditions. They are the ones that are facing the most obstacles, so we need to make this easier for them. And even though if people's motivations are high, people from these vulnerable backgrounds are quitting less and less and less because it's very difficult to. So it's difficult. Now add in those misperceptions that people have, add in limited access, add in low product appeal if flavors are taken away, and if it's not affordable anymore, and you're making this very, very impossible for people to try and achieve. So we need evidence-based regulations to facilitate population health behavior change. And I think there's a lack of understanding of many things here, and I think that's one of the main limitations of why the EU finds itself in this position. So I'm just going to go through it really quickly. Harm reduction. We keep going on about tobacco harm reduction, tobacco harm reduction. People do not understand what we're saying, tobacco harm reduction. They don't. This is words that we use, academics use it, but population at large, they don't know what it means. Policymakers, they have to grasp what is tobacco harm reduction. It's nothing new. It's harm reduction. It's been used for many different areas, such as substance misuse. It is the right to health. It is a human right to health, and it's a human right to dignity. And no one should be dying for their nicotine. Okay? So it's the concept of harm reduction, and it really is misunderstood. There's really no informed decision making here at the moment. It is a chronic relapsing condition. It is not easy to stop smoking, and I keep banging on about that again and again and again. So I think sometimes our policymakers and our decision makers don't actually understand how difficult it is, and if they did understand how difficult it was, they might be more understanding of why we need to throw everything in the kitchen sink at this. There's a total rejection of science, and there's a lot of influence coming in from outside organizations, and I won't say too much about that, but I think you understand what I'm trying to say. And we have a lot of misperceptions on harm and the effectiveness of e-cigarettes. So once these misperceptions are here, there's not really much you can do about it. Those misperceptions make people feel, I don't know, better the devil I know, I'll stay smoking. And what really needs to change are these misperceptions. But if our decision makers have them, then, you know, we're not really in a great place. There's loads of companies, there's loads of countries that the EU can learn from, just to name a few there. Yes, done. Okay. And the other thing that's preventing, I think, policymakers are fears. And I've listed it there. The youth use thing is quite big. I'll say more about this when we're speaking. But without these alternative exits that we're trying to strive so hard for, we're only going to ensure and protect the easiest and the most deadliest route to consume nicotine for the smoking population, and that's combustible tobacco. And I'll leave the rest to talk about with Philipp. Thank you very much.
You can keep that, yeah. Please have a seat. Also Sydney, would you come up to stage please too? And also we have a special guest, it's John Dunne from the UK VIA. You can clap for him too. He's a nice guy. Haven't seen him biting anyone.
Not today anyway.
Well, not until, I don't know of any occasion, but I'm not too sure about that. So we do have 3 guests about here right now. So first we want to talk a bit about the scientific side, and again, you said reluctant condition. So we want to also have a look at the consumer side, and then also, like you are with the UK VIA, so you have great insights also from the markets, from the companies, so with many people. And Sydney, I want to start with you first. Well, the TPD3 is coming, right? So requirements are going to be new requirements, new big requirements, whatever. So how should responsible companies compose their scientific programs? How should they go forward with that?
So I think we can infer a lot based on the differences from original TPD to TPD2 and kind of infer what we're going to likely see with TPD3. So most likely nicotine pouches will be covered and come out of that gray area with this new TPD3. I think if you're in that category, it's a great time to start the non-clinical testing that you're going to need. There likely will be a period where those products can continue on the market, but they will have to likely submit dossiers containing all of that scientific evidence. So you can go ahead, you can get started, you can then try and leverage that if you want to use it for other regulatory submissions like a PMTA. But I think getting started as soon as possible is probably the best way to do it, especially with the stability data you need. Those studies do take a while. So if you want to have a good shelf life for your product, you want to make sure you get started on collecting that data.
Thank you very much. Also, you mentioned Johnny, right? So 40 cigarettes a day, and then he stopped smoking because he started vaping. And you were in this program, Smoke to Stop, right? So it's a reluctant condition. It's really hard to get off of cigarettes. And well, whom of you has stopped smoking? Who has stopped smoking? Right? You too? Yes. So most of us have stopped smoking, right? And it's not easy, isn't it? So swapping for stopping may be a good option. So what do you think, what features do we need in products and also in communication to help people swap to stop?
Like I was saying, if we talk about communication, I think people don't understand that it is less harmful, and I think that has to be corrected first, whether that's done by public health campaigns, and we're crying out for it, I know, in the UK at the moment. But it is so hard to stop smoking that I know even in my clinics, the slightest excuse that I can't do it or I shouldn't do it because that's not safe, they'll take it. They'll take it and they'll go, no, it's better off doing what I know, because the brain is trained to just hold on to that so tightly. So information is really key. But product use is fundamental. If it's difficult, if it's fiddly, if the battery runs out quickly, if it looks, I don't know, if it's got a name on it that is like H2O or water, like it has to, you have to describe what it, the flavor, what it is. Otherwise people won't buy it. They want to know what they're getting.
Yeah.
So, but it has to be easy to use. Something that's fiddly, that's not going to happen. And we saw that with disposables.
Yeah.
So when disposables came on, so many people were able to take it up because it was easy. Just so you take a disposable out of a box and you use it. You don't even need a lighter. So ease and information are the most important things, I think.
So with everything, communication.
Exactly, and communication, and also nicotine strength. It needs to be giving you an effective dose of nicotine because you are smoking from the are smoking for the nicotine.
Yes.
So you need to be able to replace it. So Johnny needs to feel as if he's not missing out on anything.
Yeah.
And that the switch from smoking to whatever he's using, whether it's pouch or vaping,
Yeah.
is as seamless as possible.
Oh yeah, yeah, I can see that. Johnny, also Johnny, right?
Yep.
You've been with the UK VAI. It's a long name, right? So with the UK VAI, it's not as easy for me. You've been with them for a long time, and also you started the Global Vape Alliance with some of the other folks, which is really great actually. And there are some, I don't know how to say that, hard-boned myths around vaping, about non-tobacco products out there. So what are the myths that are holding on the longest, that are actually not true? And what do you see still, even on fairs like that? So when people are talking about, you think like, what do you think about that, right? That's a problem. What do you think about that? So what are the most common myths? How do we solve them?
If I hear popcorn lung once more in my life, I will go insane. You know, when I do interviews and I talk to politicians around the world, I hear the same things. They're just as bad as smoking, aren't they? They cause cancer, don't they? They cause popcorn lung. The answer to that is no.
No.
And they always try and compare it to somebody who doesn't smoke, somebody who's breathing fresh air. And absolutely, vaping is not good for you if you don't smoke.
Yeah.
You shouldn't be doing it. But the vast majority of these people have been smoking for many, many years. They are, as Sairah pointed out, they have a 50-50 chance of dying from using these products if they use it in the way that it's intended. And vaping and reduced risk products, while they're not perfect, they are hugely more beneficial for you to use. And I think that's the biggest problem we've got right now, is the smokers that are on the edge, that want to do something, are so confused about what they should do. Because every time they open a paper, they see so much misinformation. And now even in the UK, which Cyrus was talking about, the success story that we have, we're the most successful country in the world for using e-cigarettes for adults to quit. We now have 5.3 million people vaping. But we have a government now that's looking to ban flavours, that's looking to restrict the advertising on these products. They have a very fine line between getting this right, to make sure that young people don't get the products, which we don't want them to do in the first place, and absolutely messing it up.
Yeah.
We did a survey this week, 3,500 people responded. 50% of them said they would go back to smoking if flavours were banned in the morning.
Really?
50%.
That's a lot.
Now we've got 5.3
So they
million
would
people vaping.
quit smoking, they would go back.
They would go back.
Yeah? Boy, that's harsh.
But that goes back to it needs to be easy and appealing, and they need to like it.
Yeah. Yeah.
If they don't like it,
Yeah.
what's the motivation for them to do it?
So it's not about new customers, right? Not about getting new people in the market, but it's actually swap to stop.
Yeah.
So we're targeting the smokers. We want to have them vape to have a less harmful alternative for their lacking condition, right?
And I think that's a good point that you made. The people that are anti-vaping, the people that are pushing this wrong narrative, they don't like the fact that people enjoy this way of giving up smoking. They go, well, they should be stopping that as well. But why?
Yeah.
It doesn't make sense.
Crazy, right? So there's many data on risk reduction out there, right? And some is more credible than the other. And so how do you think we should present data that the data is as credible as possible, so people will really believe it, right? So they will not be like, okay, who made up this data, but actually see that and like, okay, cool, that's nice, that's credible information for me. How do you present it?
So I think a lot of it, unfortunately, there is a ton of scrutiny when it comes to industry-funded studies, which can be incredibly well done. They have the money to do them well, and unfortunately, when they come out, even if it's an amazingly large sample size and all of the data, you can look in the supplemental information is there is still going to be a ton of scrutiny. But I think another big thing is the communication of this science, and it's just not there. Like John was saying with popcorn lung, you open up social media and it's everywhere. So you have to think about where consumers are getting the information and how it's being translated to them, not just the collection of data, because there is a ton of data out there and it's good data, and we're just ignoring it. I mean, you have governments that are ignoring it. I live in France. They are completely ignoring the data and just banned nicotine pouches due to one scientific publication showing that they might cause negative oral impacts. Did they look at those impacts compared to smoking? No, It was just a standalone study, and that was enough for the government to take that and misinterpret it. And now the fine for possession of nicotine pouches is worse than the fine for heroin possession.
I didn't know that.
Yeah, but
That's
if a
crazy.
government can get it that wrong,
What?
if a government can get it that wrong,
Yeah,
then what
people-
are consumers supposed to believe?
That's a problem, right? And this would be my next question for you also. So how do we get that right? Because let's say Johnny's using the products for nicotine, not for 7,000 chemicals in a cigarette, right?
Yeah, yeah.
So he's doing that to get a better life than the life he had before. So how do we actually communicate that in a good way?
I think when you were talking about the communication of science, it's also about who is communicating that science. You know, brands can't communicate it. Industry associations probably can communicate it, but it would be received better if the NHS communicated it. Now, the NHS does communicate it, but on their website. There's no big social media campaign. There's no, you know, back in our day, it used to be a billboard or on the back of a bus or something like that. There's no, you know, mass media public health campaign on it. And it's things like that. CR UK, Cancer Research UK, they could be doing a lot more. So it's there, it's on their website, but it's not being amplified. That's in the UK, and we're at a very good position in the UK. At least these organizations, these medical organizations, these research organizations, acknowledge it and they have statements on it. But it's not, there's no speaker to it, and it's not reaching the masses. So number one is about who is communicating it. So it needs to be health and government.
Yeah.
And how is it being communicated? Well, it's being communicated on a website, but is that efficient?
Yeah.
Enough to change behavior change? No.
Everybody's just Googling everything with ChatGPT now, so
Yeah.
it at least has to be there, right?
Yeah.
So yeah, okay, yeah, that's crazy. John, you are he's a very influential man, I would say, right? So you're with the government in the UK all the time, right? You do have contacts also to the government in the US and wherever because of the Global Vape Alliance. So as that influential person in this matter, so what do you think the industry can do? What can the alliances do to actually help communicate the right science? Is there any chance you see to do that?
I think speaking to your politicians directly, even as a consumer, holds a lot of weight. Because as Sairah points out, when we go and speak with them, they would go, "Ah, yeah, the industry would say that, wouldn't you?"
Yeah.
But you know, what we're going to look at now is we looked at how people will vote for their politician if they're negative against vaping or using these products. So we're going to be launching a campaign in the UK to talk directly to each politician to say, this is the smoking rate in your constituency. This is how many people have successfully quit using vape in your constituency. And this is how many of them will not vote for you in the next election if you take away their flavors, if you make their products harder to use.
Oh, interesting.
So that voice, I think, is the strongest because that's what each politician will listen to.
Yeah.
But we in the UK, though, we have a problem. Is individual MPs understand it, they get it, and they know that these products are good, but they have to do what the government tells them to do. So they will vote the way the government wants.
Yeah.
And unfortunately, we have certain health officials now in our country that are more guided by their Instagram following than they are by the science. And this is where we're going wrong.
Who isn't, right? So we do have 10 minutes left. I would give the speech also to our, well, lovely folks here, if that's all right with you. So do you have any questions that you'd love to ask? Any question? Anything? I know that you have always a lot of questions.
I'd ask Sydney, how do you move the needle?
All right, come on. Let me give you the mic. It's easier there.
Thank you. I think I'd ask Sydney, you know, how could one move the needle in France? I mean, do you see this as taking a decades-long program, or you know, how do you short circuit, you know, this detrimental move that we're seeing in France? What can be done? Do you think?
So I think it goes back to what John was saying and really trying to communicate effectively with the government. Again, unfortunately, that really can't be coming from industry. It can be coming from, you know, whether it's UKVIA, whether it can be coming from GINN and experts that have, work and are in the industry or are industry adjacent and are not at a big tobacco company. But again, it's really communicating the science effectively to the government, which is not understanding it. I know that Sweden is trying to block it because of EU trade laws, and I hope that they're successful. But I think it really is going to take a tandem effort with consumers and also the scientists going in and talking about, looking at this paper, which again, who here has gone through a scientific paper? They're not the easiest to navigate, right? So that needs to be toned down and communicated effectively to a government. Otherwise, they're just going to read the headlines.
And to you, John, it's not all bad news in the UK. I think UKVIA have achieved a measure of success, because now in the UK, you actually, as you said, you have more vapors than smokers. I think you've reached that crucial point. So there is, as Sairah was saying, programs such as Swap to Stop that have been effective in encouraging this change. So it's not all that bad. I mean, do you see any green shoots of recovery or some glimmers of hope?
I think one of the things we're really lucky in the UK is to have a government that does actually engage with us. So even on things like taxation, I meet with the tax office every single month to discuss how the new tax is going to be implemented. And they have changed things that benefit the industry a little bit. So we're hoping that when the new laws come in May, and the government decides, well, which ones shall we use and how will we implement them, that we'll be fully engaged in that program. So I think there's a glimmer of hope there. On the pouch side, I think there's some positives that will come out of that, because right now it sits in that grey area, but they've already said pouches will be brought into the same legislation. So I think that will be a good thing. You'll have the age of sale, you'll have the nicotine strength levels maximum, and I think that will legitimise that category in the UK. So I think that's going to be really good. But going back to France, I think France is in a great position because consumers in France are very vocal. The last time they did something on vape, there was 60,000 responses to it. And we've already seen the French government backtracking on potential taxes on vaping products because consumers were complaining. So I think if consumers can get behind pouches just as much, I think eventually they'll backtrack on that as well.
All right, thank you very much. I knew you had questions. So we do have 5 minutes left, and I would kind of like to know, so what is one do and what is one don't that companies should do to be taken serious about tobacco harm reduction? It's not that easy, right? So what should they do? Maybe we start with you and then we end with you. Thank you.
For me, at the moment, the biggest fear for any government is youth.
Youth, yes.
It's massive.
Yeah, definitely.
Absolutely
yes.
massive.
Uh-huh.
And so I would advise any company to really focus on their product, their packaging, everything, to make sure their flavor descriptors, whatever it is, to make sure that they cannot have the finger pointed against them and go, look what you did. You did that. You caused that. So really, a consumer research really is needed to make sure that you are getting that balance. You talked about the balance of making sure that we're preventing youth uptake, but we're able to appeal to smokers, to Johnnies, to make sure that someone like Johnny will feel that it's attractive enough to use, but that a kid would go, yeah, that's not cool enough for me, or whatever. I mean, I remember when I was working for Juul, I used to ask my teenage kids, this was back in 2019, do any of your kids use a Juul? 2019, this is before disposables. And they said no one would be seen dead with a Juul, mummy. It's like, that's for old people.
Socially dead.
Yeah.
That's great.
Well, I mean,
well,
they were like, no, we wouldn't, it's not.
Okay.
However, as soon as the colorful highlighter pen, that came in, they were all over them.
Yeah.
So I would say that is my main thing. Just really do your work to make sure that you're appealing to an adult smoker, but you're not appealing to somebody who's under 18.
Thank you. So one do, one don't.
Okay, so this is kind of piggybacking off of what Sairah said and the youth access and youth uptake issue that every government is interested in, every regulatory body. Be responsible when it comes to the nicotine strengths and also the flavors that you're using, because realistically, the dessert flavors, the caramel whipped cream frappuccino, they're going to say that appeals to youth more. As they are, and they're going to say, especially when it comes to these super high strength, whether it's pouches that we've seen a lot on social media and people taking them and throwing up, to be responsible and to, you know, make responsible decisions for your company when you're designing the products. So those are some don'ts. When it comes to a do, I would say it should be pretty easy for everyone in this room to demonstrate that your product is less harmful than a cigarette. So make sure that you have that data. Make sure that you can show that to the regulatory bodies, because otherwise you saying it without any data, I mean, ultimately when you go and you submit applications to the FDA, it's a bunch of scientists that are reviewing it. They want to see the data, and it should be easy to generate that for every product in here. They are less harmful than cigarettes. So make sure you do the studies, have them done well, and be ready to defend that data and your product.
It's an easy bet, right? Just showing up data that smoking is more harmful than anything else, right? That's fairly easy, I would say.
It should be easy, and it's easy data to generate, and there's, I'd say from a product stewardship standpoint, you should have that data.
Yeah, I think I agree on all of those points. And going back to 2019, I think that's when my life changed, because it became more difficult. And I gave a speech in China on disposables. They were 5% of the market. 6 months later, they were 75% of the market in the UK. It changed that quickly. And then that's when we had the youth issue. That's when the conversation changed from, these products are great, we should lower the taxes, to, we need to ban this, we need to change this, we need to tax them out of existence. So the industry has to be very, very careful. And they've also got to understand that this is not a lifestyle product. This is not a trendy product. This is a product for adult smokers to use to stop smoking. That's it. And until the industry realizes that, and most of them do, most of them are very, very good, but it's the small minority that are bringing out things that look like toys, that play games. Regulators do not like this.
Play games?
Oh yeah.
Your vaping stick.
No, there are vape devices where there's a little Tamagotchi on it, and the Tamagotchi will die if you stop vaping. So you have to keep vaping to keep your Tamagotchi alive. Done. Game over, yeah?
And the only thing a politician will say to that is, look, I knew you were just marketing the show.
Yeah, that's the best example of why it should die, right? Obviously, All right, cool. Thank you very much, all of you. You will be available all day, probably tomorrow too, so if you are with us tomorrow again. So what you do with us is don't play the youth game, do it the right way. It's a product for adults who want to stop smoking and have a more healthy life than with the cigarette. I guess that's the point, right? So thank you very much for joining. See you around.